Good afternoon. Thank you for the invitation. My name is Teun Schutte. I'm a researcher. I research patient experience, patient journeys, or actually I like to call them family journeys because it's mostly not one patient, but the whole family that is impacted. This research about craniopharyngioma in the Netherlands, in Germany, and in the UK was funded by Rhythm Pharmaceuticals. They were not involved in creating the interview scripts. That was all mine, and I had feedback from the patient associations in the countries involved. So we conducted the interviews in 3 countries, and we talked to about 32 patients or parents, or patients and parents in the 3 countries, and healthcare professionals to understand the health systems. We talked about the complete journey, about the search when the first symptoms started, to the diagnosis, finally, surgery, most of the times, immediately, rush, and to the treatment afterwards, and the monitoring and the continuous monitoring, or the recurrence and monitoring. Lifelong journeys. Because that's one of the things that learned and was very obvious, that, as one of the mothers told me, at that moment we thought, let's do the surgery. Then we're done and we can move on. It wasn't that simple. And that was a story that was repeated over and over and over, that I heard in all the 3 countries. And we heard today about the challenges on daily tablets, hormone replacements, fatigue, always tired, but a different kind of tired that is hard to explain to people who never experienced it. And how do you tell that to a friend, or to a teacher, or to your colleague? Because that's what it's definitely going to impact. But it's also going to impact your school, your learning ability, to participate as a colleague, or your weight management, and people looking at you, and the stigmas that you get from being different. While from the outside, maybe you don't look that different. These are the things that are similar between the 3 countries. The people are similar between the 3 countries. And that's something really important to realize. You cannot move abroad to get rid of the problems. What I will focus on today is on the things that are different between the 3 countries. And maybe it's good to explain a little bit about the system. So, you are familiar here, of course, with the NHS, which is a patchwork of all kind of health system, and access to their health can be difficult. So if you want the best health, you sometimes need to travel. If we look at the entire opposite side, we have the Netherlands. There's 1 hospital for all pediatric oncology. So if you want to have good health, there is a chance you need to travel. But on the other side, they know everything about your disease, and everybody will get the same and proper care. Although access to healthcare in Netherlands can be in other domains also be challenging. Germany is actually a bit in the middle. They do have this patchwork, but it's organized around bigger centers, and they have a registry for craniopharyngiomas across the country. So every patient needs to get into the registry so they can at least benchmark the quality of care, which is a big difference compared to the UK. What I want to look at is 3 situations, 3 moments in time after the treatment to compare the 3 systems and the experiences from the patient. So the first one is the continuity of care, actually from your hospital to home. And what we see there is what a lot of families explain, that after the surgery, the entire team changed. There's only one who stayed the same, if you're lucky, and that's either your endocrinologist or your nurse practitioner. Sometimes there was no handover of care, and people just dropped off. The best experience was there where there was an official rehabilitation program, sometimes 3 or 4 weeks, where you, as a parent with your child, was internalized in a rehabilitation center and really got to learn your child, and especially how to handle hormone replacement. Because you need to listen to the small sounds, you need to see the small signs from your child and recognize them in order to act in time. And this was, unfortunately, this rehabilitation project was in the Netherlands, but was discontinued, lack of funding, but this was by far the best experience described. The second part, and you will also recognize, and it was described really well by one of the fathers actually here in the UK, is you're discharged and suddenly you're a nurse, a psychologist, a dietitian, a teacher, all at once. There are so many different things you need to learn as a parent, you need to handle as a parent, you need to manage as a parent when your child is confronted with a craniopharyngioma. And this required multidisciplinary care. This requires support on all different elements. And we've been talking, and I've been listening to a lot of talks where it's about the different medical care you get, the endocrinologist, the dietitian, the physiotherapist, the neuropsychologist. But we also need to remember these families need support with education, with sports activities. Finding the right sports activities, for example, can be really tough if you're blind or near blind. But also with funding, getting access to money. And this is unfortunately where all the 3 countries have the same challenge. A lot of these non-medical support that these families required are really based on the local authorities. And what we observed in the Netherlands, if you look at the local authorities and the access to this additional support, which is so required, is that the more wealthy communities give more access to support, which in my point of view is the world upside down, because literally the other communities will need it more. So, and what you also see is that if you give this multidisciplinary care from an early age, as soon as possible, you will prevent the traumas. You will prevent all the challenges that people need to cope with. One of the parents explained in the Netherlands they were really happy with having the dietitian in a really, really early stage to at least discuss what their child's need was. It transferred from a guilt, feeling guilty that your child is overweighted, that you do something wrong, into something supportive where you can both work on as a family. So multidisciplinary care as soon as possible is really important to give the survivors a proper chance to grow. And the third phase, which you also recognize, is the transition of healthcare. The transition to adult care. Like a young woman described who just turned 21, I believe, when we talked to her. Turning 18 felt like falling off a cliff. Everything changed. The whole team changed. In some countries, for example, in Germany, it's not always that obvious that you get access to an endocrinologist when you're older. They have a shortage of endocrinologists. People just get lost in the system. They use still the protocol on how to use their tablets every day, and they just copy it for years and years and years and years and years, and there's nobody to check it. While we also know that it's way more sensitive through all the life phases that you need to go through. Especially in elderly care, when you really become older, there are so many question marks yet. So transition of healthcare. What are good examples? Good examples are some of the heroes that are also sitting in this room that guide people really literally to every next step and to the adult physician, to the adult consultant. But not everybody has the time or the funding to do that. So because you actually need double consultants for several times for actually every discipline that you've been seeing as a patient. But if you do that, I believe that it will pay out later, because you will save so much problems for these children, for these families, for these young adults actually later in life. So spend money on getting the transition right, transfer all the knowledge you have about this person and their needs to the next stage. It will pay out. Not only mentally, but also financially, I'm sure of that. And these are the three things that I really think. So really think that should work. So if we focus on the continuity of care, if we offer everybody a person, a social care worker, a nurse practitioner who can be there before, directly after diagnosis, until the months that the families learn how to look at their child and use the hormone replacement therapy. If we can help them with early support, multidisciplinary support, and continue that support and checking in. So one of the stories that I always remember is that families saying, we didn't need psychological help at start. We could do it, but they were already so happy that they were being helped. So it was in that moment that they didn't need the psychological support. But years after years, they realized they had the trauma build up from the moment in time they were processing this all, but getting access afterwards was horrible, really horrible. And that's in the UK, but it's also in Germany and also in the Netherlands. So you need to offer it, but you need to check in every so many years and still check if they need the support or not. Otherwise it will go wrong. And make sure that you have a planned transition. Invest a little bit more in the transition, because it will save you a lot of trouble over time. And if you do that, you create trust with the families and a stability with the families. And at the end, also the confidence at the families that they can manage it themselves. It won't be easy. There are plenty of challenges. But they need the confidence that they at least can help and act when it's needed. And when you have the confidence and when you have the stability, there's space to grow. I didn't talk about fertility, which is one of the multidisciplinary focus points. It definitely should be there. But this quote comes from a young woman that we talked to in Germany who was diagnosed at a really early age. And she said, actually, it's going pretty well. And she could be, because she's now a proud mom of 2 children and handling her life. And I think she's even becoming a doctor. So there are beautiful stories, but these stories only exist if you get the support in the right time.